Hello, and welcome to this short informative video on the Programme québécois d'adhésion aux dossiers médicaux électroniques en spécialité, also known as the PQADMÉS. My name is Daniel Borelli. I'm a Customer Relation Manager at TELUS Health for Medesync EMR. Over the next few minutes, I will present the various aspects of the program, including its main objectives, the multiple benefits that you and your patients can derive from an EMR, the different financial incentives in place, and the requirements to benefit from the subsidy. Just before we continue, I want to mention that the information presented in this video has been directly taken from the Ministère de la Santé et des Services Sociaux website. So let's get started. All specialist physicians working in medical offices within the Quebec Health and Social Services Network and providing services covered by the RAMQ are eligible for the PQADMÉS under certain conditions, which I will share with you in a few moments. The program's main objective is to encourage the adoption of an approved electronic medical record system, or EMR. An EMR offers the benefits of having a computerized system that centralizes clinical information for the second line of treatment. It also improves the quality and security of the clinical data, promotes multidisciplinary work and interoperability, and enables better management of access to services and appointments for the second line of treatment, and facilitates electronic referrals. With the use of a certified EMR like Medesync, the advantages and benefits are significant for healthcare professionals, clinics, patients, and the healthcare system as a whole. For healthcare professionals, access to clinical data and test results is simplified. Follow-ups for specific patient populations are made easier, and there is a reduction in time lost due to clarifying prescriptions. Additionally, EMRs save time through the use of numerous electronic tools and forms to streamline repetitive tasks. For patients, the benefits are also notable. EMRs ensure an improved continuity of care and allow for a multidisciplinary approach. Furthermore, patient safety is improved through electronic prescriptions and quick access to clinical data. From an economic perspective, there are several advantages associated with the use of an EMR, such as cost reduction and increased revenue through improved productivity, optimization of support staff time, in some cases, getting some storage space back from physical filing cabinets, and finally, better billing recording with a noted reduction in errors. For the healthcare system as a whole, we see a reduction in emergency room visits and hospitalizations, a decrease in duplications for prescribed tests, and reduction in costs through quick access to diagnostic tests, enabling early interventions. Finally, using a certified EMR also provides healthcare professionals with a comprehensive tool that offers numerous advantages. The majority of professionals using an EMR will attest to a reduction in non-clinical activities and travel due to remote access to patient records. An approved EMR like Medesync will also provide simplified access to the DSQ and CRDS portals. It also gives access to a multitude of clinical tools and customizable note templates, as well as allowing the transmission of electronic prescriptions and dynamic electronic forms via eFax or even through secure messaging via a patient portal. Lastly, EMRs can optimize communication within an extended team and network of professionals as a whole. Now, the subsidies granted to specialist physicians include a one-time lump sum of $2,600 per specialist for change management related to the implementation of the EMR. This initial amount will be granted automatically with the first reimbursement for license usage fees. Reimbursement is also provided for the cost of the EMR license up to a maximum of $2,200 per specialist per year upon submission of supporting documents such as an invoice with the physician's name clearly stated. Please note that if you are already using an approved EMR like Medesync, you can also request retroactive reimbursement starting from January 1st, 2023 for its usage fees. Detailed instructions for the reimbursement procedures will be provided in your client space within the Mon PQADMÉS portal. You'll be required to upload a copy of a void check for the direct deposit of your reimbursements. It is possible to submit more than one reimbursement request during a calendar year. However, it is recommended to submit requests on a quarterly, semi-annual, or annual basis. In order to enroll in the program, the specialist physician must meet a few criteria, which include being in good standing with the Collège des Médecins du Québec, providing medical services in a clinic covered by the RAMQ for a minimum of 2 days per month, participating in all ministerial projects related to technological integration and optimization of EMRs, and finally, the specialist physician must hold a license for the use of a certified EMR solution in Quebec, such as Medesync. To obtain any reimbursement under the PQADMÉS program, it is imperative to submit an online request through your Mon PQADMÉS client portal. At this stage, make sure you have your secure email address ending in .med provided by the ministry. If you have not yet activated your .med address, you must request one by completing the required form available on the ministry's website. For more details, you can refer to the following link that will appear on screen. This concludes today's presentation. If you have any questions or would like to learn more about the PQADMÉS, I invite you to fill out the contact form by clicking on the link provided. On behalf of the entire TELUS Health team and Medesync EMR, thank you for joining us today.